So let's ground this in clinical reality. I'm going to talk about the back pain person that I saw yesterday. And again, yin and yang. And within yin and yang, we can look at, is it hot or is it cold? Right? Some people talk about a hot, burning, stabbing pain. Some people talk about how, their back feels cold and it feels better when they put heat on it. And so with making a diagnosis in Chinese medicine, diagnosis is the most important part. How you treat it, there's a lot of ways to treat it. But the important thing is you first have to know what you're looking at. You have to be very clear in your mind what is the cause of this person's problem, or what's the probable cause. Your treatment is going to be a way of testing your hypothesis. In medicine, we talk about having a diagnosis. I think of it as a hypothesis. This is what I think is going on for this person. I'll get to treatment in a moment and why you need to be precise with it. But back to diagnosis. Is it hot? Is it cold? Do they feel better when they put pressure on it? Or do they feel better when there's no pressure on it? Again, is it better with ice? Is it better with heat? Are they worse with motion or better with, if they take a little walk around the block, do they loosen up and feel better? If the answer is yes, that's an issue where you've got stagnation. If they walk around the block and it's worse, oh, see, they're already weak and now they've walked around the block and now they're worse. Now we're looking at a situation of weakness. So again, excess or deficiency. Is there too much of something or not enough of something? Are they hot or are they cold? I'm trying to dial in what it is that they need. And again, for those of you that are not familiar with Chinese medicine, think about your own medicine in terms of how you rule things in or how you rule things out in terms of what you think is going on with the patient. You want to try to get enough things lining up that makes sense for ruling something in, or again, ruling something out. This is where constitution is helpful, because if someone comes in and they're very damp, what I mean by that is they retain fluid, they're fat, they probably have a puffy tongue. I'm probably going to first rule out that they're too dry because they've already got too much fluid. So whether you're ruling things in or ruling things out, the idea is to get a clear idea in your mind what you think is going on for the person. The treatment that you choose, you can choose lots of different treatments. In terms of needle placement, well, there's a bunch of different systems of acupuncture that I could lean on, and there's a number of different methods that I could lean on to send a message to the patient's body on what I would like it to do. So again, let's come back to the patient yesterday. First of all, I'm going to call him damp. He had excess fluid. He had really good skin. Dude, this guy was like in his 70s, hardly a wrinkle on his face. You look at his heels, he's got these nice, fleshy, not dry, not cracked, just like he's got heels like a teenager, right? If you look at older people, their heels are often really dried out. This guy had like really nice heels. So he's damp. He's got extra fluid in his system. Tongue kind of puffy, coating on the tongue, a little bit greasy. So very clear to me, this guy, number one, has too much fluid and we need to dry him out a bit. And so I chose a particular acupuncture treatment that would work with particular organs that help with fluid metabolism. What those points are, it doesn't matter, right? What I'm talking about here is the principle of seeing who's in front of me, the problem that they're manifesting, what I think are the major factors that are leading to that manifestation, and then doing what I can to reduce the things that I think are problematic for him, either with acupuncture or herbs.